All right. Hi, everyone. On behalf of the Florida Department of Health in Volusia County, welcome to our interactive session at the Path for Hope Virtual Summit. You have joined the Harm Reduction Interactive Session, and my name is Helena Gerard. I will be the facilitator in this session, and I would like to welcome Nancy Rice, who will be the subject matter expert for this session. We will have your microphones on mute until you're recognized to speak. We definitely encourage you to speak. You can just raise your hand and be recognized to participate. You may also submit questions and comments in the chat feature, and I can read them aloud. You're invited and encouraged to turn your cameras on for this session. And thank you to the Path for Hope Summit Planning Committee partners, Advent Health, Community Coalition Alliance, One Voice for Volusia, SMA Healthcare, and the Volusia Recovery Alliance. I have several questions to promote the discussion, but we're just going to see where it goes. And I can start by asking for examples of harm reduction, or Nancy, if you would rather ask something else to get the group going, it is completely up to you.
Yeah, I'm happy to kick things off. Thanks for having me. Nancy Rice, and I work for LSF Health Systems as the State Opioid Response Project Team Lead. And I'm a licensed mental health counselor, and I'm really happy to have this discussion with people. And I welcome any questions or debate or conversations about this, because like many people, harm reduction was really new to me until a couple years ago. And I love to be wrong about things and to learn new things. And harm reduction was one of those areas which has helped me to grow a lot as a person and as a clinician. So I'm happy to share some of my thought process too, and learning to embrace harm reduction and change my thoughts about it along the way. This is a really new area for a lot of people. So there's oftentimes just a lot of lack of information or misinformation or myths that surround this topic. So I'm happy to talk about some of those things, and also some of the trends that I'm seeing across Florida as this work in harm reduction continues to expand and become a little bit more mainstream. But yeah, some examples of what harm reduction are, first of all, what exactly is this? What's harm reduction all about? The the basic definition of it is anything that you're doing to help mitigate an otherwise harmful behavior. And in the field of opioid use disorder and addictions, the most popular form of harm reduction that we usually talk about, or trainings that I do, are around the use of Narcan. And that often kicks things off as being sort of a controversial topic sometimes about the use of Narcan and what that means in certain communities. So I'm kind of happy to start there. If anybody would like to talk about Narcan or the other thoughts on harm reduction and how that's coming up for them locally in their communities.
You can raise your hand, put something in the chat. All right, Whitney.
I'll kick us off.
Yes.
Thanks, Whitney.
Yeah, no problem. Two things come to mind. One thing is, and Helena knows this story, but it's very embarrassing. I really was like anti-Narcan, hardcore anti-Narcan. And I said it in front of a bunch of people and they corrected me. And I was like, oh my God, that was so embarrassing. And then I started thinking about it differently though, because I was really like, that's just enabling people to get high, and then Narcan, and then boom, you can continue to get high. And although I'm sure there are some people that do that, they're alive. And so whether they're choosing to do it that way or whether they're using it as a life-saving device, it doesn't really matter. What matters is that they're alive. But most people are using it as a life-saving device, the vast majority. And so I just didn't get it. I did not get it. And thank God there was people who took the time to explain it to me, because otherwise I would not understand. And the other thing is, like, we were talking about this in the previous session a little bit, but like the hesitancy with law enforcement to use it is very interesting to me. I meet with a lot of law enforcement. And so there's some that are like, totally get it. And then there's others that are like, they're being told that they can't use it because there's liability issues and stuff like that. So it's really interesting just in all the different communities to see how it's viewed. And like there's communities where they don't carry it and in their cars. I'm like, what do you do? Like, how? No wonder your numbers are high. You know, that's interesting. Okay, like it makes total sense. Like, okay, now I understand. But it's just, I don't know. It's interesting. Narcan has been totally controversial, and I think that until people have that genuine conversation about it, it can be confusing. It can be confusing. Like, well, that's just a consequence of their getting high. Well, you know, today's day and age, like that, well, I guess they're just gonna have to hit bottom is usually death. It's not like death is one option. It's like death is the number one option now. And you might get to come back and you might get to try again. It's more of like death is inevitable if people continue to get high right now. It's pretty crazy. So those are my thoughts that I was thinking.
Yeah, thank you, Whitney, for bringing that up and being willing to admit that you had your own biases about it. It's not unusual. For a lot of people, again, this is just a completely new topic and they haven't thought about it in any other way. And I certainly don't want to pick on law enforcement because they're not the only, community struggling with this. This is across the board. But a really good example, I heard about that at the behavioral health conference this past year. I wasn't there, but somebody else shared this example that I thought was really impactful, was within law enforcement talking about, well, the choice to carry Narcan versus not carry Narcan is, would you rather administer the drug and help to save somebody's life potentially and they can go on to get treatment, or would you rather make that death notification to the family that this is another overdose, and which is really harder to do? And that's unfortunately the reality, Whitney. That was when we're talking about the with the fentanyl being introduced and so many of the drugs that people are using, that it's often not the luxury of just because people experimenting with drugs anymore. It can be, one pill can kill is the saying that is being used now in a lot of public health campaigns because of all of these rogue prescription pills. They're not prescription; they're made in these pill mills that are out on the market. So, and I think that's what's changed the mind for a lot of people is, they haven't kind of jumped on the train of harm reduction. They're really getting left behind because the overdose rates are so high that people are looking around going, the old way that we were doing business is just not working, whether that's in mental health and law enforcement and the ERs across the board. So what can we do new now? So, fortunately, sometimes it has to be to the point of crisis before people start to look at what else can we do differently to help with this epidemic.
I well, admittedly had the same perspective. Like, it was enabling and all those thoughts. And I don't remember when it changed for me, but I know that it did. And it was, I don't know which funeral it was, but I know that there was a funeral that I was at that one of my friend's children, and I was like, man, if somebody had some Narcan, they'd still have their mom. Like, it's hard though. It's hard, it's to overcome those things that have been, kind of put in our brains to change it to that. And I think, you're right, the old way, it's so different. I heard somebody, I don't know if it was day 1 or day 2, and I wish I could remember which presentation it was, but they were talking about the years when all these things were introduced. Maybe it was, and I was like, that's why I'm still alive. Like, that's why I'm still alive. And it never occurred to me. It didn't occur to me that these things haven't just always been there and I just got lucky. Like, that's what I thought, that, oh, fentanyl's been around and I must have just gotten lucky, or maybe I didn't get any, or whatever it was. And I know that fentanyl is, was used medically, but it's not like it is now. And when it was definitely an aha moment for me. And I was like, that's why, like, wow, what a, that's why I get to be here today. So, other people don't have that luxury if they're still using. So, all right, let's see. Recovering Futures has their hand up.
Hi, kiddo. How you doing?
Hey.
Hey, well, for anybody who who hasn't heard some of my spiel yet, chiming into these little events, which have been wonderful, by the way. I've gotten a ton out of them, and I made a lot of connections so far. So it's really been phenomenal for me at a perfect time. The other thing is, the subject of this is harm reduction. So I want to throw out there, we're talking about what is not traditionally considered harm reduction, but maybe we need to rethink. And I really think that one-on-one interactions, with like-minded and like-past people, like certified peers, licensed, the licensed ones, not the other ones, but to get those, even once a week communications or something like that going, to check in and share that whatever, or and how flexible they can be with you, I don't know. But if you need somebody for if you leave a sporting event and your friends are turning right and going to a bar and you need to turn left and go home, maybe it's easier if you're talking to somebody on that walk. So I think that community, definitely, but individual connection, as somebody who shares your past in as much as they can and understands where you're coming from, is a key component of harm reduction. And with that, I will shut up.
Thank you. Great point. The introduction of certified peers has been instrumental in shifting how we approach recovery. It has been, I've worked in different states over the years in mental health, and it's kind of interesting how and at different times that the use of peers working within the system has come about. Some states this has been around for a long time, and in other places it seems to be quite new, and there can be some resistance too within the mental health community of bringing people on board, whether that be in the ERs and these mental health clinics. The response from people that are receiving treatment, like you were talking about, it's so vital that there's this acknowledgement of different pathways to recovery. And oftentimes the way to get through to somebody is to say, I've walked in your shoes, I've been there.
Exactly.
Let's have a conversation about this. And some, in that same line of thought of different paths to recovery, for some people, that's a 12-step abstinent-based model. And some for people, it's not. It may be the harm reduction type of approach. And that's a real paradigm shift for a lot of people in the mental health community.
Yes.
And it can be, we were talking about stigma in the previous talk, that unfortunately we don't have the the luxury right now to have that sort of, there's blinders on anymore because, you know, we're in the middle of an
Yeah.
unprecedented epidemic that without having sort of an open mind to different pathways. It,
Well, the open-minded community certainly got a boost from COVID. You know, the telecare and other communities like I, myself, and others engage in are, you know, oh, they're so needed and so unavailable, you know, for referral and stuff like that. So, no, but there's a lot of people working on that problem. And it'll be solved. But the interaction at the basic level. Let me give you an example of what it's just a phrase that I heard that really bothered me, and it was really within the VA community, and it was like we need them to fail at the lowest level that they can fail, right? And so if you've heard it before, I'm sorry to repeat it, but it bears repeating that they are already failing at the highest possible level. They cannot care for themselves, right? And the activities of daily living without a substance that may cause great bodily harm to them and therefore future damage to everybody around them. So, you know, they're failing at a pretty high level. So why do we want them to enter the treatment level at such a low level? So I'm not in agreement with it. I can't say that I've closed the door on it depending on what happens afterwards, but let's just say that I'm not on board yet. But and I think we may need to rethink what we think is a lower level of care. The independent interaction between a peer and a client, especially if they can maintain that on a longer term basis, just like their therapists and counselors and stuff, the more people we can reach. So maybe we need to rethink, hey, what's lowest level of care? You know, it's maybe they can't work their way into a room, you know, and share experience, strength, and hope and stuff like that. But maybe they can log on to an app and go, you know, I'm going home right now and I'm having some pretty evil thoughts, you know? So everybody is rethinking. COVID pushed us into rethinking further, but our response can't stop. We have to keep catching these people at every single opportunity. Every opportunity. When they ask, we have to deliver. Thank you, guys.
That reminds me of a really interesting conversation at the Opioid Summit a couple years ago. They introduced the topic of, these are people that are working with individuals with opioid use disorders, and said, what does success look like for you? When you're working with somebody with an opioid use disorder, what is success? And for some people, it was that person is still alive. For other people, it was they have not used for a certain amount of time. For some others, it was they haven't used opioids, but if they've used marijuana or other drugs, you know, that was success. For some, it was, well, maybe they're still using opioids occasionally, but it's less, but they're able to maintain a job. Their relationships are more intact. They're, you know, they're working towards that. And I thought that was really interesting. And I thought that really exemplified harm reduction, that there's this kind of continuum, and how we think of success or healing and recovery can really even differ for the individual. And meeting that person where they are at, like you were just talking about, is actually quite powerful.
Whitney.
I think also what you were just saying, it's also not imposing our version of success onto the person. I think that's so important, because sometimes they're like, I'm totally successful. What are you talking about? And I'm like, no, you haven't done XYZ. And in order to be successful, you got to meet XYZ requirements. And I think that, at least I'm starting to learn, that that's not necessarily the best way to do treatment. It's, you know, a lot of times it's what the person determines their success is, you know, and I can't keep them in this box. Like, I've got to allow them to have their successes without me imposing my version of that onto them. I mean, obviously we have to sometimes for DCF and the treatment plan and that kind of stuff, but in general, like if I'm asking a person, do they think they've been successful? And I'm over here thinking, no, you know, they're going to know that, they're going to feel that. And that's not fair. You know, if they feel like they've been very successful, let's build on those successes. You know, I think that's also what harm reduction, it's very strength-based in my mind. Like, let's build on those strengths. You don't have to be completely abstinent to be going in the right direction, you know? And I don't know. I also would love to talk about the more outlandish ideas in my mind of like the supervised consumption sites and things of that nature, because like, you know, even needle exchange for some people is like, but I don't get it, you know? And it's funny, I was talking to a probation officer and they were saying that, and I was like, well, let's talk about HIV. Let's talk about hepatitis. Are they going to stop using? No, they're not going to stop using. So why not just give them a clean needle? Like, otherwise they're going to find anything and everything to shoot up with. So let's just find something clean. Like, and they were like, oh yeah. So it's just sometimes we have to, I don't know. I like having these conversations because it grows my understandings. So.
I want to talk about syringe exchange next, because let's kind of get things really going with that conversation. But I see there's a question or comment from.
Oh, go ahead, Nancy. Recovering futures again?
Hey guys, yeah, I just wanted to say, you know, just kudos on all that. I just added that in there, so you know, in case you know anybody or whatever, look us up, reach out. I mean, we'll do anything and everything to make something happen for somebody. That's just about the bottom line. So yeah, I really want to talk about the needle exchange and hear about that, and more of the harm reduction things that are in place. Thank you.
Thank you. Thank you, Dawn.
Thank you. I appreciate your work that you do with veterans. Yes, so harm reduction, there can be facets of it where some people say, oh, okay, I can get on board with the Narcan, but it's a bridge too far to talk about syringe exchange or safe injection sites. So let's talk about that, because it's not just one matter. There's a lot of different moving parts to this. And, you know, Whitney, you kind of shrugged when you said, oh, it doesn't match with the treatment plan, but, you know, that's a big deal. When you have these approaches that don't match with the policy or the laws, I mean, that's where the friction really starts to happen. That's where rubber meets the road, and you can't just ignore that. So while you may have a belief or desire in a community to do one thing, but let's say someone is on probation, let's use the example of marijuana use. Medical marijuana is permissible now in the state of Florida. If somebody is on probation and they're having to do urinalysis and they do that and they're positive for a drug, marijuana, and the probation says they cannot have any drugs in their urinalysis, or they're in violation and they can go to jail or go to prison or lose their children. That's a serious thing. That's a tangible thing you want to avoid. If you're looking on the harm reduction side of things and that individual's treatment and support groups, and they're saying, well, we recognize there's all paths to recovery. You're not using opioids at this point. You're using marijuana. It doesn't seem to be causing problems in your life. How do you marry those two things when you don't have, you know, the policy that's matching with the philosophy? You can't just ignore that. So that's very real. With syringe exchange, this is another example of where you have policy and desire to change things in the community don't always match. So in Florida, it was not until 2019, I believe, when there was the law that was changed, and this was the governor said, okay, we can have needle exchanges in Florida, but only if a city or a county changes its legislation and there's a city ordinance allowing that to happen. So if somebody's coming in and passing out needles and they don't have a city ordinance, they can be arrested. So while there's sort of this message that we want to do the right thing and have a safe exchange, there are steps that have to be followed in order to do that in a community. And so that at this point, they've had in Miami-Dade County a needle exchange now for a number of years, the IDEA exchange. And for those of you who attended some other of the conversations during the summit, I know that there was talk about harm reduction and safe needle exchange and the efforts to do that. But there's a lot of different places that the counties are at this point with introducing that. So there's some really robust conversations that are happening in different communities about getting those laws passed. But happy to hear from, kind of stop there at this point and see if there's any questions or dialogue about what may be happening in your community in terms of a needle exchange. Well, I'm not hearing anything else on that particular topic at this time, but the other point that you brought up, Whitney, was about the use of safe injection sites. And if you don't know, if anybody doesn't know what that is, these are locations that people can go to and administer drugs in a site where there is staff present to be there if there are any issues, if the person that potentially overdoses, or also to talk to people about getting into treatment or helping them with hygiene or even wound care. And to my knowledge, that is at this point not legal anywhere in the United States. I've was doing some research into a safe injection site up in Canada. That's the only place that I've seen that currently exist. But have you heard of anything happening with that in the United States, Whitney?
Yeah, I was just typing in the chat. I think they have them in New York, because I think that's where the Harm Reduction Coalition is out of. So I think in New York they've been successful with doing that, with starting those. But other countries are great examples. And again, I was like, absolutely nuts. Why would we do that? Like, I mean, my eyes were bugging out of my head. And so now I kind of understand, like, if I'm getting high and I choose to go to one of these sites, and that friendly face that greets me at the door and has helped me, you know, if I decide that one day that I decide to get help, who am I going to go to? You know, I'm not going to go down the street to my pastor. Like, I'm going to go to that place where I've been using drugs every day and that person hasn't judged me. And I feel totally safe with them, really 100%, because maybe they've even Narcan me, saved my life. Like, that's who I'm going to ask for help when it comes time. And I just think that's so impactful. I never thought of it that way. Or the fact that so many people use alone, like, when you look at the data, especially recently, I've seen the data in so many different Department of Health meetings. Nancy, you've been in several of them, where they show the graph of where people are overdosing, and it's residential homes. That's the residents. That's huge, which means they're probably using alone. And so then, you know, that to think that somebody could go to a site and not use alone and yet not be involving other people, or I don't know. There's all these things that just made my brain kind of start going about it. Also it's like, you don't have to be around somebody else that's, maybe you're tempting them to get high or something, you're going to this place that's really a safe place. So it's interesting. It's such an interesting idea. And I've heard about it being successful in other places. And like you said, like the wound care, people just don't think about that, or asking someone if they need help with that. Do you need help with that? And then they can say yes. Maybe nobody's ever asked. That's the other thing too. So many people have never been asked. We think like there's an assumption there that of course they know about help, and of course they know where to get it, and of course they've declined help, but maybe they've never even been asked. So I just think some of these things are like what started to really change my mind about harm reduction in general.
Yeah, the same thing with the syringe exchange sites that you're talking about with the safe injection sites is these are places where people can go to talk about and get access to treatment. So if they're, like you said, if they're there on the right day and they're ready to get help, there's people on site. I mean, these are set up so it's a continuum of care. It's not just about exchanging one-to-one needles. You have staff that are there to talk to people about their treatment options, that are there to help with healthcare, with Narcan, the whole continuum. And like you said, if this is a spot that somebody associates with, these are people that really care about me and I feel safe, I think people are probably more inclined to be open and receptive to getting help from a place like that. If you feel accepted and safe somewhere, that's probably where you're going to let your guard down and let those kind of conversations happen.
And they're not trying to change them. Do you know what I mean? Like,
right,
oh, you're not trying to change
yes.
me.
Right.
I know that's been impactful in my life, my personal life. Like, oh, you're not trying to change me. Okay, cool. We can talk,
Mm-hmm.
It's different. It's totally different.
It's a very different way of thinking. And, the outcomes from the syringe exchange programs, I think on the surface, people look at it and say, well, gosh, isn't that giving permission, to use drugs, and you're just giving this out? And the reality is the average person isn't going to say, oh, they're giving out free syringes, I think I'll go do this today. I mean, this is for individuals who this is part of their life. It is the addiction is in full control, and they don't have a choice in the matter at the time. And when they're able to go to a location like this, again, they're able to get access to care that maybe they wouldn't normally be exposed to. For individuals who also have done these syringe exchange programs for a number of years, they talk about in those cities, and this has been shared on those calls with the Idea Exchange, they see immediately that the numbers are going down in the counties in terms of disease, TB, HIV rates, hepatitis rates are reduced. So on just the level of cost and reduction in disease, if an individual isn't maybe able to get on board in other ways, if they can see that is a reduction in healthcare costs that really go to all of us, sometimes it helps to change their mind about things. And also the reduction in syringes that are on the ground. When a syringe exchange comes into a community, it is very black and white in terms of the litter that is on the ground with that overnight, because there's a place to dispose of these syringes and get new ones. And on a community level, we want to reduce the chances of anybody accidentally stepping on a syringe in an area. And in communities where there's a syringe exchange, those things get better overnight. So again, there's sometimes a lot of ways of the second order effects of these programs that people are able to see, wow, it really makes a difference. And it really helps the community when we see these start to be instituted, and that starts to change people's minds and start to do this type of work.
Absolutely. Don shared, Portugal has tackled this head on with relatively good success. And Whitney said in Ocala, a person is doing syringe exchange on their own and she's getting 2,000 to 3,000 needles a month. Wow. Yeah, it's the success. I remember seeing a documentary when I went back to school and I was early in recovery, and it was a documentary that had a syringe exchange, and I was just the same, eyes popping out of my head. Like, this is not like that. Why should they get that? Like that's ridiculous. Like that's no. But now it's like, there are just so many benefits. It's, I guess, the same as Narcan for me. Like at some point it changed, and I don't know when that aha moment was for me, but now I just think, like, I can't imagine ever going back to that. Like, there's just so many benefits. I can't argue myself out of it, kind of thing. But yeah, the litter, it makes me, one of my friends posted on Facebook, her son was getting on the bus and there was a syringe at the bus stop where the kids were getting on the bus, and she was like, what do I do? You know, like, it's just, there are just so many benefits. And I'm just glad that you're bringing them all up. I think it's important. And I think the overdose fatalities, one of the presentations I saw that had, it was the comparison of Canada and the US and the safe use sites. And while they had overdoses, they had 0 fatalities in the time. And I just thought, 0, like 0, what a strong argument compared to what we're currently doing.
Yeah, I think that was a really good point that you make, Helena, that you weren't quite sure what moment it took where it sort of changed your mind that you were more open to harm reduction, but somehow it just started to happen. And I think that's why it's helpful the more that we can educate people about this and offer those other perspectives that can help open their minds to another way of doing things. Because as we've mentioned, now we're at this point where within a lot of these systems, people are saying we can't arrest our way out of this problem. We can't, keep doing things the way that we did before because they're just not working. So what other ways can we go about trying to tackle this issue? I don't know if anybody here was able to listen to the medical examiner when he spoke yesterday for Volusia County. Did you hear that, Helena? I don't know if anybody else was. That was really a fascinating point of view. I've never heard a medical examiner talk on those side of things. We hear about these numbers and what overdose numbers look like in the community, but I've never heard from somebody on those side of that side of things to provide that particular service. And it was so alarming to see the information that he shared just within that community in Volusia County, what he was seeing in terms of the overdose numbers that were coming through his office and the stress that was causing on his staff in terms of doing autopsies and reporting this information. Was very eye-opening for me about this. Was just another side of the community that's seeing the effects of overdoses that I just really never thought about being on the front lines of doing this work. So it's really interesting that a lot of times that it has been individuals in the medical community that seems like they have been more open to harm reduction because they're seeing the mortality aspects of the overdose epidemic, and it's opened their minds of having new ways to do things. Even with MAT, medication assisted treatment, that is the evidence-based form of treatment for people with opioid use disorder. It's to be on medication. And for a lot of people, that's new information to them. They're thinking, well, isn't it the best way to go about getting off a particular drug is total abstinence from that drug, and or getting counseling. But MAT is this whole other spectrum and ways of doing things where you're on a medication that's helping to reduce or get rid of those cravings, and at the same time you're getting other interventions, community interventions, or counseling, other supports to help with those issues. So again, just harm reduction is a new way of thinking about solutions to an old way of doing things.
Absolutely. Nancy says that was a great presentation from the Emmy, a different perspective.
Yeah, that was. Abstinence alone is lonely. Yeah. Well, that was going back to the safe injection site. Another alternative to that is there's actually a phone number that you can call. It's a never use alone phone number. And that was introduced during, I think it was during COVID that first came about. I'm sorry, I don't have that on hand, but I've seen Department of Children and Families release a flyer with that information. And that's talking about having people, you can actually call this phone line if you're using drugs and there's somebody else on the line, so that if you are overdosing or having some problems, there's a live person there to intervene on your behalf. And that's another big factor in the matter of overdoses, especially during COVID, that they believe a lot of these numbers went up because individuals were using drugs alone. So in instances of maybe somebody would have caught that they're in trouble and overdosing and had intervened, that's not happening. So add that to another tool on the spectrum of harm reduction are these never use alone phone numbers, is something that you can offer to somebody as a resource, so they're not using in isolation.
I think that's great. I just learned about that too in the summit, and I just, wow, genius. Genius.
Yeah, a really simple solution to an issue of that. Yeah.
Is there anyone on here that is currently has a syringe that's from Miami, or a place that has syringe exchanges, or is starting to use, or starting to?
If you are interested in learning more about syringe exchange, or you would like to start that in your community, there is Florida Harm Reduction Coalition that is instrumental in that initiative. I know Tim Santamore is one of the points of contact with that particular initiative, and they do host talks and provide assistance if you are living and working in a community that wants to introduce a safe exchange program, legal exchange program in your community. They talk to you about ways that you can implement that. So there are supports out there if you want to introduce that to your community. Again, you have to be able to introduce this to the city council to get a city ordinance changed. To do that, there's a lot of moving parts and pieces to this. So it really helps to have some type of technical assistance if you want to implement that program in your community. But again, you do have, in terms of policy at the state level, state of Florida is allowing syringe exchange programs if you follow the correct ways to do that, including having a city ordinance. As far as Department of Children and Families, DCF, and the managing entities, which I work for, with the state opioid response or guidance documents from the state, it does say that there's support for the creation of safe and legal syringe exchange programs. And so we are certainly a resource as well if anybody is wanting to start that in their community. to be a part of that dialogue about the mental health piece of that, and services that individuals can get linked to. So I'm happy to answer any questions about that if anybody would like to talk to me about that offline as well.
I know I will be reaching out.
Happy to share lessons learned. There's a lot to that.
I see Don wrote, you have to be strong to do the phone watch job. Absolutely. Yes. Supports for supporting people, I think is super important. I really, you know, when Whitney, when you were sharing about going back to that's the one person that you trust, and building that connection, I think it's just such a good example of community and the impact that it has. I was, you know, once I feel like that could be the last place that somebody wants that has a conversation with you. Like that might be the only place that you go to have a conversation. And you're so spot on with that. That's one of the arguments that I did not think of was that community.
Yeah.
So I just, yeah, it's, and I feel like as a community, we're, you know, like how that's a way to support. I just, yeah, not completely isolated.
And the RCOs, the recovery community organizations, do a great job in all of our communities to also engage people and meet them where they're at. I know they've been very active in a lot of this this summit. I also see somebody from VRA that's on the call, and it's absolutely instrumental, the work that they're doing in the communities and being that voice and presence that you know, people are there for them to support them where they're at, and they have walked in their shoes.
Mhm.
That type of community work too, of Narcan events. I know that Volusia County, the area has been very active in going out and doing these Narcan events to introduce that to the community. And I think just even having that presence of being at events to pass them out, and the safe Datera bags for medication disposal. You're talking, I keep going back to that thought, Helena, at what point did your mind start to change that there's different ways to help solve this problem and reduce the number of overdoses? And I think even just community exposure at events to show that this is a resource and that this is just something that people do to be compassionate and help is very important in terms of communities' perspective in normalization of these harm reduction practices.
Yes, the normalization. That reminds me of the last Volusia Recovery Alliance event they had. It was driving into recovery, and everybody, the people that weren't from Volusia County, that they were like, this is amazing, that it would never happen in our county. There was someone from Georgia and just I think stood at our table for 5 or 10 minutes just saying how much they wished that their community had something like this, and their community was as open-minded as ours, and that there were options, and it was normalizing it. That normalizing is for sure. I mean, it just should be. I guess we just keep talking about it until it's normal, and then
yeah. And if VRA wasn't there to do it, it's just because some people decided to make that happen that that's there. So thank you for doing that. It makes a difference. It's just sort of this ripple effect. And if you don't believe me, believe the Surgeon General of Florida. There is a standing order. You can walk into any pharmacy in Florida, not have a prescription, and ask and receive Narcan. Other states don't have that. It's that important to Florida to change the tide of overdoses that there is a standing order. You don't need a doctor to get Narcan. That sends a very powerful message about the importance of saving lives in Florida, that they have that standing order. The Good Samaritan law in Florida, talking about policy. That's another great example of the people are afraid of liability. You were talking about some people don't want to carry Narcan because they're afraid of the liability factors. Well, the Good Samaritan law in Florida that was implemented, it's changed the law around that if you call to get help for somebody in an overdose, that helps prevent you from being arrested in many cases for having drugs. So there's changes on a massive policy level that are showing that harm reduction is supported at the very highest levels on our state and on a national level as well.
Absolutely.
Well,
Whitney mentioned, oh, sorry, go ahead.
Any last minute questions or comments about harm reduction, or we at a good place to sum things up?
I have lots of notes. Does anybody have any presentations that touched on harm reduction that they want to share about or reflect on? Or, we can wrap it up, whatever you all feel comfortable with. And you are right, we need more funding, more RCOs to get more funding. Well, we can wrap it up, give you a little bit of extra time to grab some lunch.
Sure. Well, I appreciate the work that everybody is doing to help support individuals in recovery. And if you would like more information on harm reduction, I encourage you to do more research. There's a lot of great resources out there. And if you have any questions about anything that I mentioned today, I'm happy to be a support for you. And feel free to reach out to me if you have any questions.
Thanks so much, Nancy. And if you would like her contact information, reach out. I'm happy to connect you guys. Thanks, Nancy. This was great. Your expertise, I learned even more today. So that's great. Thank you. And attendees, please, Nancy put her information in the chat. You don't even have to reach out to me. Perfect. Please use the link in the chat to complete the evaluation survey for this session. Thank you to Florida State University for managing Summit evaluations. And thank you all for participating. Thank you for making this a great conversation. Please go to your Summit program PDF or go to thepathforhope.com/summit2021. Oh no, this session's, if you copy and paste it into Google or into Chrome, did you do that? Yeah. There's something wonky with our evaluations that sometimes they're popping up and sometimes they're not.
Hey, Helena, I'm not sure if this will help other people, but I had to open it in a private window because I think that since I had opened it before for previous sessions, it automatically went to that page. It skipped the page where you could fill out this session. So I don't know if that would help opening it in a private window.
Oh. We'll see if we can get a hold of FSU on the break and get that fixed. Because we definitely want to hear some feedback. Let's see. So if you go to pathforhope.com/summit2021 and click on the link for today's plenary session, Dr. Yang will be sharing about stigma at 12:40. So we will get that. We will try to work on that evaluation as well. And if I will see you at 12:40 if we have nothing else. And thank you so much again, Nancy. That was great. I really learned a lot.
Thanks, everybody. Have a good rest of the day.
Thanks.
Bye.